And welcome back. Well, a lot of people will be with family for the holidays, and sometimes that can be a good time to have important conversations, especially if you have aging parents who might one day soon need assistance. DR Salerno is with Amada Senior Care of Greater Milwaukee, and he is here to talk about some of the options that families can consider. Great to see you.
Thank you. Thank you for having me.
I think there's a true need for a center, a place like Amada, because there's so many, everybody's different, and everybody has different goals in terms of where they want to live, how they want to live, and how much help they need.
Correct. Yeah, what we find is that there's a lot of options available to being that they like to age in place, like to be in home. We are offering care services. So we provide caregiving services that come in the home that help things like feeding and toileting and helping them get out of bed in the morning, and we try to figure out the care plan that's right for them. Some of the clients are 24 hours a day. Some of our clients are part-time. Some of our clients are overnight service. We want to figure out what's appropriate to them, and then when care is not appropriate in the home, we can help with helping to find assisted living or also a memory care placement. So we really partner with the families, help to understand what we see. And we see that upcoming with the holidays, there could be some families coming back and that they have not seen mom or dad in a while.
Mm-hmm. And don't you feel too that, especially if they haven't seen them for a while, if you see that your aging parents or an aging loved one, maybe it's aunt or uncle or a grandparent, it's sort of like, don't wait. Have that conversation. And sometimes the holidays are one of the only times you might see them during the year or have a chance to evaluate or coordinate with other members of the family to kind of decide what's right for everybody.
In the next couple months, exactly right, you are going to be a lot of folks coming together, and they're going to see mom or dad maybe in not as they previously have seen. And so what we say is there's like a two-step approach. They're saying that have that conversation about an aging plan. Okay, do you want to stay home? Do you want to go to more of a downsized environment? Do you want to go into a community? Then look for clues, look for cues. Was there a short-term memory loss? Did you kind of miss an appointment, miss a bill paid, miss a medication, and begin to, is there mood swings? Is there agitation? Is there a clean house that's now not clean? You know, try to find little cues and clues that help to have that open-ended discussion.
I'm sure it's hard in some ways for adult children to have those conversations because you want to be respectful of your parents, you want to respect their wishes, but you also feel like it's a little bit of an invasion of privacy or kind of saying, hey, I'm noticing some things. Yeah. Do you help guide people with points for discussion?
Correct. Yeah, what we try to do is we say we're always here as a resource, and we say call the office, we can have that conversation before the meeting with the parents or after the meeting with the parents. We try to help to kind of walk through whatever, and it's a different approach depending on the situation.
I think that's wonderful. In terms of options for families and what's available, especially for 24-hour care, how does that work?
So there's usually a discrete medical need for why do they have the extended care. So sometimes it's hospice at home, sometimes there's a skilled nurse and rehabilitation discharge and they need the 24-hour care in place. And so that means that we would have the caregivers in the home basically around the clock.
Okay.
And so,
where there's someone there all the time.
Correct.
And there's a certain level of need, I'm sure, that exists with that. What if in-home care like that, even if it's 24 hours, what if that doesn't work?
That doesn't work, then we try to figure out an overall placement strategy. So help to find out, is it assisted living? Is it a memory care? What other options are there for them?
What about long-term care insurance? Because that's something people hear more and more about, especially as baby boomers are living longer and people are living in maybe their homes even longer. How do you help them find the care and find out what options they have related to that type of insurance?
We find that there's long-term care insurance that a lot of policies were purchased, say for example, 15, 20, 25 years ago.
Yeah.
When Mr. Jones was healthy, now he had a stroke, he fell, he broke his hip, he's in the hospital. Now the family's trying to scramble mode and trying to understand how do they get the benefits out of the policy that they've paid a number of years on. And so I'm in the state of Wisconsin, there's about 150,000 policies and about 4% of them are active on claim. So we help the families understand their policy benefits, do the work with the insurance company, be their advocate. So, and then we also can do the caregiving piece, and also we can manage out the claim with the insurance company.
What about staffing? Because you mentioned memory care, and I wonder about sending caregivers to assisted living, memory care communities for staffing specifically.
So there's where we help the communities in terms of able to help them fill shifts. So if it's first shift, second shift, or overnight shift, we can send to the community to help as just a resource to the community.
Almost like a liaison too.
Correct.
To that type of care. And I know you're certified by Home Care Standards as well as the Bureau and National Readmission Prevention Collaborative. So that those are probably important certifications as people look for quality care.
Well, that's the thing, that's what, it's who we send into a home is really like a reflection of us, and we try to make that a good fit. And so we try to figure out what's the appropriate plan. And so we, from like a discharge environment, so like a hospital, skilled nursing, home health hospice, we try to keep our folks safe. We try to not have them readmit. We try to keep them home and not have them come back.
It's wonderful. So great to talk to you. Wonderful services that you provide, and quite a breadth of services as well. Really, the call to action here is to make that appointment, to schedule and get information, because you have a wealth of resources available for families. And the key is don't wait. If you see a decline or think a loved one needs more help or a certain kind of care, do it now. The holidays are a great time to have these important conversations. You can call Amada Senior Care. You can also visit them online at amadamilwaukee.com. Thank you again. We appreciate it.